Good afternoon, everybody, and welcome to Zahn Academy. Today, I want to welcome Eugene Royzengurt, who is a licensed denturist, and he's here today to talk about digital modifications to removable prosthetic workflows, and that's featuring Pac-Dent resins. Rodin, Titan, sculpture, right, Eugene? So
Yeah.
he's ready to give you the lowdown on it all. And I just want to welcome you all to right here at Zahn Academy. Want to let you know that Eugene has put together some poll questions for us, and I'm going to start launching those at the very beginning before we get started with his presentation, so he knows exactly, who he's speaking to. And we will have a live Q&A at the end. So we're going to get started on the first. So I'm going to turn this over to Eugene.
Hi, everybody. So nice of all you to be here. And we're going to spend some time together, about an hour or so, talking about the removable pros and fixed pros a little bit, and just integration of all of that into your workflow. And a couple of things I wanted to mention. If you guys have any questions for me, obviously you can ask them here, but also if you take a scan of this little QR code, it gives you a link to all my social media stuff. So you can watch videos there and look at my posts, and also private message me and ask the questions that maybe you're not understanding, or maybe you're running into some problems and you want to see how to fix it and stuff like that. So this is a good way to get a hold of me, guys. So today I'm going to talk to you a little bit about different materials that I'm using for my workflow. And I'm not trying to be very material specific, but at the same time, this is a webinar from Pac-Dent and Zahn, and we're talking about those products. But I'm going to talk about different things related not just to those resins in general, okay? So majority of us, if you're dealing with removable pros, for example, are doing some kind of duplication of models. Now, for me, I stopped doing regular model duplication for, like, for example, if you're doing a partial denture and you're processing on a stone cast, and then you need a duplicate to fit that processed denture tube. And I used to do that with hydrocolloid. And after a while, I started doing, as you can see on the screen, I started doing silicone. And then I switched over to doing 3D printed. Now, in some cases, like if you see right here, when I'm doing like a locator bar case that I'm trying to process on, I will still do something like this with silicone. But majority of my partial cases, I will do just regular printed models, something like this. Now, for printed duplicate models that you're fitting your partial dentures to, I don't necessarily purchase expensive resins. Now, you can buy regular resins that are dental specific. They're really precise. But for something like this, where I just have to fit the model, the denture to, I don't really need something that's expensive. So I just buy hobby resins that I just use with my regular non-dental printer, and it works out great for me. And I pay, like, not a lot of money for something like this. However, if you're looking for something that let's say, for example, you get a scan from the clinician, or if you're a clinician yourself and you're doing a partial framework, so something that needs to be perfectly fitting and needs to mimic as close as possible to what's in the mouth, then I need a resin that's going to be nice and stable over a long period of time, and that's going to give me the best possible outcomes for those things, okay? Now, be aware of certain things. Some resins, even though they're nice and precise, and you end up printing something like this, for example, where you're doing a prosthesis that's a screw retained prosthesis where you're fabricating a bar, this will fit perfectly right from the start. And I had this happen with this particular case. And then we tried to mount this to an articulator, and I don't know what happened. I wasn't the one that was mounting that, but the excess moisture from stone got into that resin and it warped it. So some resins, even if they're dental specific, you might have some issues where you're going to have some discrepancies. And when it comes to bar dentures, like bar over dentures or hybrids, that's a very, very important thing not to screw up. So I try not to use that for these kind of cases, and I still use something like this. Okay, and that works really well for me when I'm using a stone cast with proper liquid to powder ratio, and I'm using a low expansion die stone, like a 0.06% expansion, and I've been getting great results with this. Now, I'm not saying this is not a good way with some resins. You just have to be really cautious with what you do. So right now, what I do for my frameworks, for example, I will use Rodin's model resin. I have found that to be pretty precise, and we've done quite a few partial cases, and we've had really good fits, guys. So I'm really happy with this. But also important, you see how I have a honeycomb grid in this model? There is a reason for that, not just because I want it to look cool underneath, but all that reinforcement inside the resin, when you mount it to the stone, if there's any kind of water absorption and everything else, that honeycomb grid is going to keep everything together. It's going to make sure you have the least possible distortion. And also, when you're taking it off the printing plate, you're not going to get into problems where you maybe too much pressure will kind of mess things up for you. So for me, this resin has been working great for these partials. Okay. Now, if you are doing, for example, a duplicate denture technique, we've been doing a lot of these over the years, and I started off doing the analog version of these, and I used to use these little flasks. They're length duplicating flasks, and as you can see right here, I actually blocked out the undercuts with some stone and some acrylic, because the way I used to do it is I would used to put silicone in there, do one side, place the denture, and then do the other side. Important thing to remember if you guys are still doing it that way, make sure you put some kind of separator between the layers of silicone, because if it gets stuck together, it's really hard to take it apart. But this was one of the ways of doing it. This was another way. I was using one of these flasks. I think this one is from Fast Pro Tech. I've done it with using soap dish cases. I've done it with those flasks using alginate. Not as great, but it worked. And we've even done them with just using the other sides of impression trays. So whatever was working at the time, we were using it. And, we would either do them in orthodontic resin, or this was a tray resin that we used. As you can see right here, the teeth were short, and I was actually chair side placing a denture tooth in there to adjust things. Or we would do them in white acrylic, and then basically the clinician would reline these chair sides, and we would use that as our final impression and a bite registration at the same time. So basically from this point, we'd go straight to the setup. And a lot of people are still doing it this way. If you don't have digital capabilities, it's a proper way to get things done. However, guys, if you do have an option to get into digital, this particular step is one of the first things that I started doing, and it worked out great for me. So basically, there's a lot of ways you can do this. You can just scan the dentures in the lab, or as you can see right here, I actually did this for my stepdad. I took my intraoral scanner with me to his house, scan the dentures there, and then you can print a replica of that and use that to take a wash impression and also take a bite if you don't have too much discrepancy. But if you have a lot of discrepancy, that's fine. You can skip maybe a try-in stage, not skip, but add an additional step of doing maybe a wax trim, because these dentures a lot of times will make a really good custom tray. And they will also allow you to take a closed mouth impression, because I've learned over the years a closed mouth impression for removable is a lot better than an open mouth impression. And that allows you to do it in an easy way. Now, let's say, for example, you got a case where the patient did one of these Dremel adjustments, is what I call them, where there may be a gagger, or maybe they were not feeling really comfortable with the denture, and they took a Dremel and they cut a bunch of it out. Well, what you can do is you can digitally modify it, or you can just add a little putty in that area and scan that in, and then you can create a replica using that. So there's a lot of things that you can do digitally to simplify things, but you don't always have to do it digitally. Some things you can do analog, some things you can do digital. For me personally, I prefer to do things in digital way if they're easier, in analog way if they're easier. Like, I don't know if that makes any sense. You know, I try to find the best possible workflow for what I do, okay? Now, let's say, for example, you got a case that looks like this, right? Patient has a severely worn down posterior occlusion. Patient has an acquired class 3 occlusion because of that. They became prognathic over time. But the fit to the patient's residual ridge is somewhat okay. What I will do is I will take patient's denture, I'll scan it in, I will print a replica. And the reason why I like using replicas and not patient's original denture, because oftentimes, whenever a patient wears a denture, they will have ridge resorption. And the dentures are not usually adjusted to that ridge resorption, so they will become overextended. And if I take the patient's denture and start adjusting it if they don't ask me to, and I give it back to them after they've been adjusted, after I've taken a wash impression, oftentimes you'll hear complaints and like, well, it was a good fitting denture, and you just ruined it for me. And I like to avoid that as much as possible. So what I try to do is I'll try to take a replica, and then I'll adjust the borders to reduce the overextensions. And what I basically will do is I'll take a little bit of ultralight viscosity impression material, and I'll put it on the borders, and I'll do like a little, like almost like pressure indicating paste or fit checker to see where the overextensions are. And then I will reduce those overextensions. And after that, I'll take wash impressions and a bite, and I'll mount it like this. Now, it's obvious that we're having some occlusal issues here, right? Because we have a prognathic class 3 bite, and the patient is not scalarly class 3, it's an acquired class 3. So what I will often do with something like this, as you can see right here, and you see why that happens, right? Whenever the patients will wear down posterior occlusion, they still need to bite on something, right? So they'll try to find that bite, and they'll start bringing their jaw forward more and more and more to try that anterior occlusion. And you don't want to replicate that, because if you do, basically what happens is if we capture that class 3 and we build the posterior occlusion to that class 3, all of a sudden the patients will notice that, well, I can actually bite on my back teeth, and they'll start to deprogram, and you'll get an anterior open bite. In those kind of cases, you'll have to 9 times out of 10 remake the lower. But here what I did is I took that case, I set some anterior teeth to kind of show where we're going to get the best possible aesthetics, because we're going to do a try-in for the anteriors here. I cut all the posterior occlusion on the upper, and I cut all the anterior and posterior occlusion on the lower to create a little bit of a space there. And the reason I did that is so I can incorporate a Gothic arch tracer into that try-in, right? So at this point, I can do an anterior aesthetic try-in on the upper. I can't really check phonetics too well because I have that tracing plate on the top. But I can actually capture the patient-centric relation and then do a setup from that point. And 9 times out of 10, I get really good results with doing Gothic arch tracers. It's one of my favorite things to do, guys. Okay. Now, for try-ins, I use this particular resin. The reason why I'm such a big fan of Rodin products is because they've taken things to the next level, in my opinion. Because a lot of times when I've used other try-in resins, they were really brittle. And I'll be showing you some other things for fixed here, not for hybrids here, where I actually print stuff that I need to adjust. And if you have a really brittle resin, it's really difficult to adjust. This resin is not brittle. It's more of a kind of almost rubbery a little bit. So it makes it really easy to grind. It doesn't clog your burrs. That rubberization is not that much, but it's enough not to chip big chunks away from your try-in, okay? Now, a lot of times we'll do immediate cases, right? And there's been a lot of discussion about immediate stuff like this. And digital really helps us out when we do immediates. This particular case we've done with a friend of mine years ago, actually. with Dr. Perry out of Texas. And this patient had most of her dentition still. And what I got back from him was just these models, and we were just doing some discussions of where we need to place the teeth. And it made it a little bit difficult because I couldn't line things up with patients' pictures, with patient scans and stuff like this. So I did this in analog. As you can see right here, I actually took a golden proportion and I've waxed up this central to give me the proper length, and I've adjusted everything to it. But we also talked about doing a bunch of bone reduction because the patient has such prominent bone presence. And we did good. I mean, it ended up looking pretty good. So this is the setup. And then I processed the case and created some alveoloplasty guides. Back then, the way I used to do alveoloplasty guides, and if you guys are still doing an analog, this is an easier way to do it. You basically take a putty impression of the inside of the denture, and then you do like a surgical guide suck down on top of that. That gives you a really nice alveoloplasty guide for the doctors to do bone reductions. And this is what she looked like after surgery. So not bad, but there's a lot of risk involved in something like this. Now, going forward, now that we're doing digital stuff a lot, I got a case like this where this patient he's a war veteran, and he was wounded during combat. He was actually shot in the mouth, and the bullet went, you could see like his eye is messed up, and unfortunately he's got some brain trauma as well. And in the mouth, everything, they kind of put him together really quickly at the military hospital. And obviously they were more concerned about saving his life versus his occlusion and aesthetics. So whenever we were doing this case with the doctor, with a prosthodontist, initially the prosthodontist wanted to do the dentures and do surgical guides right away and do immediate extractions and implant placement. And I advised against doing that because you could run into some really serious problems because you don't know what the aesthetics are going to look like. And if you want to change stuff aesthetically, maybe bringing in reduce the lip support a little bit or increase the lip support a little bit, it's really difficult to get everything dialed in from the beginning when you're doing immediate dentures. So I really advise not to do implant placement with immediate dentures. I prefer to do immediate dentures first, have the patient heal up, make sure you get your aesthetics and your occlusion dialed in, and then and only then use that for surgical guides to do the implant placement. I think that's the best possible way to get things done. Okay. For him, we had some pictures. We didn't have facial scans, but we had intraoral scans. As you can see, this is where the trauma is. So we did kind of like an obturator / denture here. This is the lower, and we got it kind of articulated digitally. And we also had the voice analyzer, which I was able to incorporate into the digital workflow as well. So I dentulated the patient digitally here, and then used the patient's picture to line up the best possible way. Now, it's still not the greatest here, but according to the doctor and me, this is the best possible thing we could do at the time. Now, once it's completed, we can start adjusting things, looking at him intraorally. Once he heals up, okay, should we bring the plane of occlusion up a little bit? Should we close his bite a little bit because he's showing a lot of lowers here at the time? So things like this can be done moving forward, okay? So we actually printed these dentures, and the guys at, I didn't actually print these ones. The guys at Rodin, at Pac-Dent, printed them for me. They did a great job. Now, obviously, this is severely overextended, but we adjusted that before delivery, okay? Now, if you look at this resin, there are many different denture-based resins out there. There are many different tooth resins out there. But the reason I like Pac-Dent stuff is because it actually works, bonds really well to stuff, and it's got some really good strength to it, guys. So for this case right here, I work with the University of Utah dental residency program, and they deal with like trauma cases and everything else. They go up to the OR for patients. And this particular patient was a dentulous partially dentulous on the maxilla and partially dentulous on the mandible. And then they needed their jaw wired because of facial trauma. So what I basically did is I actually printed these kind of base plates with occlusion built into them, as you can see right here, out of Pac-Dent, Rodin denture base resin. And I put in these little wires in there and just I attached them with a little GC trad resin. And it worked wonderfully. I mean, there was a lot of strength to it. They actually were able to drill right straight through it and screw it into the patient's palate without any fracturing or anything like that. And it worked out great, as you can see right here. So there's a lot of force being put on these things, and they still did not fracture. Okay, so for what I generally use for my temporary dentures, I do not at this time print permanent dentures, simply because I need to see a long-term study, like a 5-year long-term study, personally, how this stuff behaves intraorally, what the water resorption rates are, what staining is like, and just fracture and everything else. Now, there are lab studies out there definitely showing that it's got some really good results. But for me, I kind of want to see things, you know, anecdotally. I want to see other people doing it, and I want to see what it looks like. And if they're happy, then it's fun. Okay. So basically what I did for a bunch of these temp cases is that I will print the denture teeth out of sculpture or out of Titan. Usually the denture teeth I will print out of sculpture. Titan is what I usually use for hybrids. And then I will bond the teeth to the denture base using the either denture base material, or you can actually use the glaze to do that. And it works out great and it bonds really well. Okay. The newest thing that I started doing is using this soft reline material. Now, if you guys do a lot of 3D printing, especially for removable, you will know that soft liner material just does not stick to denture bases, whether try-in resin or denture base resin. There's, I think, 1 or 2 out there that it actually does stick to. Not all of them, but some of them. I think Dentsply is one of them, but majority of them, they don't. And if you guys want to spend, I say $1 million on Dentsply resin, then it's up to you. For me personally, I don't want to do that. So this material here will actually attach really well to printable and to regular PMMA as well. Okay. And I've had some really good results. I mean, guys, I've posted videos on Instagram. I've posted videos on Facebook where I've attached it to a printed resin and I could not rip it off with my hands. Okay. So really, really good bonding protocol. The important thing with this stuff, just follow the instructions, guys. You know, when they tell you to use this little Scotch-Brite wheel to roughen up / polish the surface of the denture with, make sure you do that, because if you skip this step, the stuff will not bond. So follow the instructions. So basically, I had a case where I was working with one of the residents up at the up at the general practice residency at the University of Utah, and this patient needed partial denture / obturated. So basically what we did is, once the denture was processed, chair side, we've reduced the surface of the denture to create this nice little butt joint, okay? And with that, we were able to create nice and flush margin, right? Then make sure you use that little Scotch-Brite wheel to prep the surface, after which you want to make sure to apply the primer. Okay, don't forget the primer, because it's very important as well. Apply it over the entire surface where you want to bond the actual soft reline material. And once that dries, you can go ahead and apply the actual material to the top of the denture. And from there, we inserted it intraorally. I had a little bit of a bubble here, which is not a big deal, because one thing, you can just polish that out if you wanted to. Or the great thing about this material, it'll stick to itself. So you can actually fill that bubble in and just polish it out. I cut the excess off with a little bit of a 15 blade, and then I just polished it up. And we did this about, I think, almost 6 months ago. Haven't heard anything back from the patient, so it must be doing well. So bondability is really good. Okay. So I really like doing this stuff, and it works out great for, in this case, this is regular PMMA. But let me show you a case where we did something with printed. Now, this particular patient, we had to work really quickly. once again, working with the hospital. Patient is a heart transplant case. So if you guys are not aware, whatever you're having any kind of transplant done, organ transplant, they view your oral health very closely. And if you have any kind of periodontal disease that can cause you any kind of problems long term, they will extract all your teeth to make sure your risk levels will go down. And this patient, we had to work quickly because he's like, surgeries were scheduled and everything else. So the doctor calls me up like on a Friday, like, yeah, we got this case. I'm going to send you a scan. Can you make some immediates for me really quickly? So I did that. I tried to do both, actually. I tried to do a try-in resin one, and I actually wanted to do a duplicate one as well, but we just didn't have enough time to do the duplicate one. What I mean by duplicate one is when you have the gingiva in pink and you have the teeth in white, right? So this one's like a try-in one, okay? But since we didn't have enough time, I just did it this way and sent it to the doctor. And then she did the surgery, tried it in. There were some issues with the bite and issues with the fit. So they did some wash impressions and a new bite, sent it to me. But as you can see right here, they used quite a bit of like bite registration material to do the wash impressions. And that really opened up the patient bite. So when I mounted everything up and tried to set things up, I'm like, well, this looks like a class 2. If you guys know removable, if you open the bite a lot, then you're going to have a class 2 occlusion. If you close the bite a lot, you're going to have a class 3 occlusion, right? So when I was seeing this class 2, I'm like, oh, something's off. So I said, you know what? I'm going to do just a try-in resin. And when we printed it, I'm like, well, that looks way too long and way too big. So basically what I did for this patient, I said, you know what? Let's do this. Let me reduce the occlusion manually here. That's what I did. And then do a reline with that Rodin soft reline material. As you can see here, it bonded really well. I was even able to get some extensions with this material. And I basically adjusted everything, gave it to him, said, you know what, let's let you heal up for a couple of months. Let's deal with your transplant stuff. And once you're healed up, we're going to use that to build you a whole new denture, okay? And from there, we can do printed, we can do a printed try-in. A lot of times, guys, I'll do a printed try-in, especially for patients that are, I'm not sure on the occlusion, for example. A lot of people will have an elusive occlusion. They don't have a stable bite. They'll bite here one time, they'll bite there one time. So I'll do a try-in, and then I'll print that try-in and I'll give it to them to wear for a couple of weeks to make sure the bite stabilizes. And if it stabilizes, then we'll move forward to get things done. Okay. So this is what it looked like for the reline. Look how much I had to reduce on the teeth. I mean, this is just crazy how much work we had to do. Okay. So it kind of looked like this. Not great aesthetics, but something that he can wear until we get things lined up. Okay. Hope it makes sense. Next thing is, next thing I want to show you guys is surgical guides. As I mentioned before, I try to do a temporary denture, have the patient wear that for a while, and then use that to do my surgical guides to do the implant placement. And this is exactly what we did here. So we had a denture fabricated, patient wore that for a while, and then we made a surgical guide. Okay. Actually, no, I think I'm lying. No, I'm a big liar. Sorry. This particular one, the doctor requested denture and a surgical guide together. I don't think this was an immediate. But nevertheless, what I'm trying to show you guys is that surgical guides can be done analog. That's not a problem. You basically duplicate the denture like I showed you before, and instead of doing stuff digitally printing it, what I did was to duplicate things in a flask, do things with clear acrylic resin, and then by hand grinding the trough for the implant placement, and also cutting the line for bone reduction levels. And it was really difficult to do because you had to do a ton of grinding. You were covered in acrylic, and it's a pain in the butt. But nowadays, what I basically do is I do these printed. And with printed, you can see I got a line here to where I need the bone reduction to be done. Let's say, for example, this particular case, we did locators. So from the incisal edge to the bone reduction, you need 12 millimeters. If you're doing a hybrid, like a Acrylic hybrid, wraparound, and you need at least 15, 16 millimeters. So this line will show you to where you need to cut things and get things done. And the other one, here's the trough that tells the doctor within this parameter, this is the best for this type of prosthesis. This is the best area to place the implants. So basically what the dentists usually do is they have, let's say the patient already has a denture, which was the case with this patient. They'll put fiduciary markers on there. They'll do a scan, and you can see where the teeth will line up with the patient's ridge, okay? And when we surgically plan these things, well, I tell them, we need to do this much bone reduction. They know that, but they also will know, like, well, around the canine, we have this much bone, so this is the best possible area for this particular implant. So they will line it up on the surgical guide and they'll start doing around the canine. So these teeth are also kind of like markers that show the dentist in comparison to the CT scan where it's best to place those implants. I hope it makes sense. Now, another great thing is that you guys should know, some resins you can actually autoclave and they don't disintegrate, they don't flake or anything like this. And this particular resin works out great. And you can see it's actually blue. It's got a blue tint to it. And the reason why they did it in blue is because it's a lot easier to see if it's all the way down. Like you can see right here on the palette really well, that's sitting all the way on the tissue. And for that, I use the Pac-Dent Rodin, sorry. I don't know if it's, some people say Rodin, some people say Rodin. Whatever works, I guess. This is what I use for my surgical guides. I've actually used this resin for some 3D splints as well. And it worked out pretty well. All right. Now, guys, if you are doing any kind of resin that has ceramic in it, it is important to properly post-process things. I mean, it's important to post-process things properly no matter what. But if you're using, let's say, sculpture, or if you're using Titan, these are highly filled ceramic resins. And if you place those in alcohol to post-process them, they will get this really white film on top of them, which is not great for the restoration, number one. And number two, it's not great for aesthetics. And it's really kind of difficult to clean it out. So the material that I found for me that works out the best is the Ceramco print cleaning concentrate. Now it comes into these like 1 gallon jugs, and it's not that horribly expensive. My problem was I had to order these ones from Switzerland, so the shipping was horrendous. I think now they have supply houses here in the States that sell. I know for a fact they have one in Canada that sell this, and this stuff works great for it. So basically, you mix 4 parts of water and 1 part of cleaning concentrate. So what I usually do is I'll take like 50 milliliters of the concentrate and 200 milliliters of water, mix it together, and you need 2 batches. You need a clean one and a dirty one. So basically, let's say we're doing a case right here. I place it in the dirty one first and run it for 3 minutes, cleaning it thoroughly with a brush. After that, I will take that, clean it under some tap water, and put in the clean one, and run it for another 3 minutes, cleaning it with a brush, and then wash it with tap water again, and then I dry it and then cure it. Now, let's say you're mixing up 2 batches in the beginning. You use the dirty one first, and then you're using the clean one, okay? After you use the dirty one, go ahead and throw it out. And next time you're doing another case, you can use the clean one that you used before as your first dirty one for the next batch. So every time I do it, I always save one for the later, and then I'll dispose of it next time. So you only have to mix 1 batch each single time. The only time you have to mix 2 batches is the very first time you start, okay? Hope it makes sense, guys. And after that, I'll make sure I'll dehydrate and process it, and then I will do usually composite on top of it, okay? Now, there's a couple of different ways you guys can do composites. Usually, I'll digitally do a cutback, As you can see right here, about 0.4, 0.5 millimeters. I'll just do either one or a couple of layers of composite on top of that. It ends up looking pretty decently, guys. What I like about this particular resin, and trust me, I've tried many different kinds, okay? What I like about this specific one is the shade matching. If you do your processing protocols correctly, you will get really, really good shade matching, guys. If it says A1, you're going to be within a half a shade of A1. The reason why you can't get like exactly the same shade every single time is because the amount of material will either increase or decrease when you're printing teeth. So if you have, obviously, if you have a thicker resin, you'll have less translucency, so you might not match the shade as close. So, but if the tooth size is close to the shade guide size, you'll usually get really good results with it. And I'll put prototypes in. We usually wear prototypes anywhere from 2 to 6 months. And from there, we'll transfer the patient into like a zirconia case. This particular one was done. I did the setup, basically. I did my guys in, I use a lab in Ukraine that does my digital design. And then I'll print the prototypes, and then we'll mimic the prototypes to do the final. And my best friend, Vadim, does all the ceramic work for me, finishing. And my dear friends at Alien Milling do all the milling for me for these cases, okay? Now, next thing I want to show you guys how to do duplicate dentures that are multicolor, right? Where you have pink gingiva and white teeth. Now, the way we used to do it, it was kind of complicated and it kind of looked really, really horrible. So basically, the duplicate flask, did the tooth portion first, then I would trim everything back, place it back into the flask, and then I would do pink acrylic. And you can see the margins were kind of crappy and it just didn't look that great. Not that they look amazing now for duplicates, but definitely a lot better than this, okay? Nowadays, what I generally will do, now for this particular patient, doctor had the setup done. This letter messes me up quite a bit. But he's like, I want to use that for the temporary, and we're going to use that for placement of the abutments because it's going to be a conus case. I said, no problem. So basically, the way you do these is a little bit different. So you scan things in, you got your upper and lower, and then I usually use 3-shape to fabricate the duplicates. Important part in 3-shape, make sure you get your plane of occlusion lined up correctly, because if you don't, you're going to run into problems down the line. And also make sure you fix your scans for errors. I will usually run my scans through a mesh mixer to check for errors and to fix it before bringing it in. Once I do that, you mark this and then you mark all the teeth. Now, guys, I've ran into some issues doing this. And thank God Min Tran was around and he showed me how to do things. You mark all the teeth, and you see I only have one premolar. If you only have one premolar and you try to mark all the teeth, it won't let you skip unless you press the actual skip button, which for some reason I couldn't find. And I spent like an hour trying to figure this thing out. So if you have tooth number 2, tooth number 3, tooth number 4, but you don't have tooth number 5, press the skip button, you can go to 6 and so on and so forth. Okay, so you mark all the teeth. Once the teeth are marked, you have to segment the denture into the tooth side and the base plate side. I don't recommend, because you can see right here, you can do like a full arch, you can do 3 parts, 4 parts, or 2 parts. I don't recommend doing it in one part, because I tried doing it as one part. You usually run into issues trying to line things up if you do it a single piece. So the way I do it is usually in 3 pieces, an anterior and 2 posteriors. Okay, and then it tells you about coupling mechanism. It tells you the angulation of insertion. I don't usually change the angulation of insertion because I don't want to mess things up, okay? Now, a lot of times they'll give you a really tall height, and that can create perforations through the base and throw up errors. So a lot of times you will have to actually adjust the height of the teeth, and then we'll put things together, okay? Looks pretty good, doesn't it? Now, obviously, it's not perfect, but it's easily fixable, guys. So basically what you do is you will actually print the base plates and the teeth separate. Now, one thing I want to talk to you guys about is whenever you're printing denture bases, it's important to remember what you're going to be using those denture bases for. Now, if you're going to be relining at chair side, then obviously you can place your supports on the intaglio surface because you know that surface is going to be relining. Now, if you're not going to be relining, if you're going to want to do it like right from the start of fitting inside, then you don't want to do something like this. You want to place your supports more on the facial surface, like bringing it like upside down. Another thing to remember, the closer you are to the build platform, the more forces you're going to be pulling forces you're going to be placing onto those areas. So if I'm going to place the, let's say we had a posterior palatal seal on our maxilla, and I place that towards the build platform, that area is going to be the most distorted, okay? And if you're trying to adapt it intraorally, that's not going to work really well. So what I try to do is I try to place my posterior palatal seal on my upper maxillary base plate away from the build platform, okay? Then you print your teeth, obviously separately as well, okay? And I also wanted to print some models just to check and verify, make sure my vertical is okay and everything else. Now you can see that I'm using just a hobby resin here because it's not going to be something I'm going to be making stuff on. It's just to verify stuff. And this kind of resin, I think I'm using Anycubic soy-based resin and a frozen printer, and I pay like 20 bucks a bottle for a kilo of this stuff. So it's really inexpensive. But fair warning, this stuff is not precise enough to do any kind of precision work. Okay. So once I've printed things, obviously this resin, I was using the concentrate on, the cleaning concentrate because it's ceramic based. Denture base is not ceramic filled, so you can use regular alcohol. Just remember, guys, you need to have separate cleaning protocols for your model resins that are not FDA cleared to go intraorally versus your, let's say, denture base or try-in resins that go intraorally. Because if your resin is not FDA cleared to be used intraorally and you use it in your alcohol, the same alcohol that you do for FDA cleared stuff, you're going to contaminate stuff and that could cause some issues down the line. So I have separate baths, one for FDA intraoral stuff and one for non-FDA stuff, okay? Now, once I've cleaned everything up, I usually put in a dehydrator to dry stuff up. I use one of these box dehydrators, works really great for 5 minutes, and it just evaporates all the moisture out of things. And then don't forget to do the math, because basically you have a certain amount of curing cycles that you need to use for your resins. Maybe it's not as important for the denture base, but for the denture tooth, it's really important. Let's say, for example, I highly recommend using the AutoFlash curing units or that type of curing unit for doing your tooth resins, because it allows you to keep the shades as close as possible to the manufacturer's specifications. If using the LED type of curing units, it can change shades on you guys. It's just my personal experience. But let's say, for example, I'm curing Titan or I'm curing Sculpture. It requires 4,500 cycles to cure, but that's total. So for me to do the curing and the bonding and the glaze or a composite and glaze, it requires also a certain level of curing, right? And total combined should be 4,500, because if I go over that a lot, if I go like to 5,000 or 6,000, then my shade is no longer going to be A1. It actually will turn green. Ask me how I know that. So what I basically do is I'll do like 2,000 cycles, like 1,000 cycles on each side to kind of pre-cure stuff. Then I'll bond it. I'll use like 300 to bond. Then I'll do my composite, another like 500, another 500 for the glaze, and everything all together will add a total up at 4,500, and then I'll have a really good shade, guys. So here, basically, I use composite primer to bond stuff together. I'm pretty sure even if you don't use that, it's going to bond well, but I just like to take that extra step. And here I use the glaze to bond stuff together. So it looks really well. And basically, I just want to beautify things up. I use different glazes. Like on the teeth, I'll use the nano varnish because it's really thin. It doesn't mess up your texture. And this Optiglaze Color Clear also does that really well. This Black Bottle Optiglaze works great on gingiva, but it's a little thicker. And I'll use different colors either from Vita Accent or from GC. I try to mix and match. And here, just adding a little bit of color, maybe a little bit of composite, or maybe a little bit of denture base. And it actually looks pretty decent, a lot better than that previous analog version that I showed you guys. So a little bit of work and you can make these things really pretty, okay? And I use my models just to verify, make sure my occlusion was good and there were no issues, okay? So for this particular one, I actually used Titan for the teeth and I used denture base. I'm actually using denture base plus nowadays. Denture base was the older version. Actually should change the slide. I'm sorry, guys. I kind of messed up a little bit. I didn't change that slide. Now, you can do that this way, or if you don't want to do it this way, you can actually just print monolithic with the cutback as I show you right here. And the cutback usually I do my cutbacks in a mesh mixer like this, and just works really well. And then you can make it beautified like this for temporary. It's up to you guys. There's many ways to do it, okay? As you can see, the shade matching is pretty good. I mean, I've been really pleased with it. Okay, another way I've tried doing it, this is more recent. I actually printed, this is a prototype that I printed out of the Titan. And guys, Titan, it's been good. I mean, I've had this stuff in the mouth for like 4 months, 4+ months, and it looks really well. Obviously, there's some hygiene issues for a lot of people, especially with prototypes. So you'll see some staining, but I'm not seeing a lot of breakages. I'm seeing really good wear resistance. And for prototypes, I've been really happy with it. But basically, from here, instead of just doing a plain digital cutback, I actually split the file into two. So I had the gingival portion, and I had the prototype. And I tried some trial and error stuff, and I found out that if I cut the gingival portion into 3 pieces, it actually lines up a lot better. And I basically just bonded it with the same resin, the denture base resin, and glazed the whole thing over the top, and it worked out well. Now, if you don't want to spend all that time trying to do different digital stuff, if you want to do just a quick and dirty, ready-to-go stuff, you can print it monolithic and then just use a mixture. What I use is I use OptiGlaze color. I use 2 drops of pink and 1 drop of red, mix it up, and it comes up with that color. And you just cover the areas that I need to, and then you're good to go, okay? Another way to get things done, you can actually use carded teeth, guys, and either printed or milled base plates, and they look really nice. I haven't done too many of these. I mostly just print stuff nowadays because I still, unless I'm milling a base, I still don't want to use that for my final restoration. And for a milling for a, using carded teeth for temporary is just kind of a lot of cost. So I won't do it this way, but it's just my own personal things. Okay. Now, printed try-ins, guys. Printed try-ins are great, especially for midline adjustments. So I did this case for this patient. We did a try-in, and the doctor's like, the midline's off. Can you shift the midline over 1 millimeter? If I had a penny for every time I've heard this, I mean, I'd have a lot of pennies. So I actually created this little meme for changing midlines. And with digital, it's really easy, guys, because you can just click and drag and your midline is changed. With analog, it's a nightmare because people think like, oh, move the midline, it's just moving the midline. No, because you have to move all the teeth, both maxillary and mandibular, and just can be a little bit nightmarish. But it works really well for digital. The only downside for doing digital try-ins, guys, because let's say, for example, I want to rotate this canine chair side, or I want to maybe move some teeth chair side, you can't do that. You have to reprint the whole thing. So some doctors don't like doing that, and that's absolutely fine. So one of the last things that I want to show you guys before, because we're running out of time, we've got about 10 minutes left, and I want to answer some questions. I want to talk to you about Gothic arch tracers. Gothic arch tracers are a very important part for when you're doing a full mouth reconstruction. Because a lot of times you will have a loss of a centric relation and you need to reestablish it. If you don't do that, you're going to run into some major issues. Now, if you're doing tissue-supported dentures, maybe it's not as huge because it's a little bit easier to remake. But let's say, for example, we're doing like zirconia cases. Then it becomes a real big issue. So what we used to do is we used to do things like this, where we just buy these kits and get things set up for the doctors to do the Gothic arch tracers. But these kits are not cheap, right? And if you need to do it for a lot of patients, it becomes quite problematic, and then you don't get the case back in time, and then you run out of things, and it just becomes an issue. So what I try to develop with a little bit of help, so I actually designed a digital version of Gothic arch tracer that I can actually print for every single patient. Now, in the beginning, we used to do the screws, the metal ones, to build in. But then I've kind of designed this way, where my buddy Mark gave me a file for a screw, which was digital, and I kind of built the whole thing around it. And I have the plates, and I can actually snap this in if I need to. I don't do this a lot. I usually just attach things quickly. And the reason why I have this ball and socket joint is because sometimes you want to do like a wash impression, and it's difficult to do a functional wash impression if this thing is in your way of the tongue. So the way I've designed it is you can actually do a wash impression here and then snap this thing on top and do the Gothic arch tracing. Now, the files for this are absolutely free. I've created them and I placed them on Thingiverse, and there's actually a link and that QR code linked to these things, and you can download all these files, and there's a video in English and in Russian how to put it together. Now, choose the one that you actually understand, and then use it, guys. It's my gift to you. As you can see right here, wash impression, little ball and socket thing, place it on top of it, attach everything. I use a little bit of compound to make sure I adjust it. Basically, what you do is you adjust the screw to go up and down, and then with that screw, you adjust your vertical dimension. So you want to establish your vertical dimension first, and you adjust the screw to get that vertical dimension, and then you do your protrusive and lateral intrusive movements to create that little, show you on this slide, to create this thing right here. And the top of this point is actually your centric relation, guys, okay? So it works out pretty well. And what I basically will do is I'll have wax rims also, at least the maxillary one, and I'll mount my maxillary on first, and then I'll use my tracer to mount my mandibular to my maxillary, and then you go forward. So that's pretty much it for today, guys. We have about 5 minutes left, and then I'm probably going to use this time to answer some questions if you guys have some, and we'll go from there.
Thank you so much, Gene. Before we get to questions, I'm just going to give you the results of the poll questions so that you know from your questions what was answered. It seems like we have quite a lot of people that are already 3D printing in their lab. 82% are, and 18% are not. So that's pretty cool. And as far as what type of laboratory, it seems that 63% are both removable and fixed. And we have quite a bit of seasoned technicians here. 10 years and above, 78% of our attendees have been in their labs. So have been technicians for 10 years or above, and 22% 1 to 5 years. So that's the answer to all of your polls.
Wonderful, wonderful. That's a very nice group.
Yes, absolutely. And we do have a question here, so I'm going to go ahead and I'm going to give that question to you. We have Dan asking, how can I do a 2-appointment denture?
I think I know who this is.
Me too. Hey, Dan.
Hi, Dan. He probably saw my post on the Facebook group. In my opinion,
a laughing emoji next to his question. So
yeah, of course it is. He's such a troublemaker. In my opinion, the only way you could do 2-appointment dentures if you do an immediate denture. Here you can do like a scan or impression and abide in the first appointment, and the second one, you could skip a try-in and go to final, which is not a good way clinically, in my opinion, because I think the best way to do immediate dentures is to have only posterior occlusion extracted, all the posterior dentition extracted, do proper impressions, obviously, then do wax rims, maybe even with a Gothic arch tracer, do a posterior setup to verify that you have good occlusion, and then do anterior extraction and do final. But if you don't have that option, let's say, for example, you have a patient come in, patient has severe periodontal disease, class 3 mobility. You can't even take an impression on this patient. And the patient blatantly refuses to do extractions first and be edentulous for a certain period of time. Then we will do an intraoral scan because we can't take a whole impression a lot of times. There are ways around it, but that's a whole different ballgame. I don't want to spend an hour explaining a technique how to do like a split impression. So let's just say we do a regular scan, take a bite, maybe take some pictures, maybe like a stick bite as well, or voice analyzer, and then we'll just do everything digitally or analog, whichever you want to do, and then we can deliver it. That's my own opinion. That's the only way to do a 2-appointment denture. Now, if you want to skip a bunch of steps, I guess you can technically do 2 appointments, but in my opinion, my personal and professional opinion, you cannot create a good quality thing because patients tend to bite differently every single time. Occlusion can change. Aesthetics, patient will say like, "Oh yeah, I don't care about aesthetics. Things are fine," and then you'll get things processed, delivered next appointment. You're like, "Oh, this thing is horrible. These teeth are too long. I'm biting more on one side than this side. I don't like the buccal corridors, things like that." So I don't think you can do really good dentures. A good denture requires time, guys. Okay. And same thing if you're doing 3D printing, you can't just like, okay, yeah, because you'll go to these courses sometimes, or maybe not courses, but like at the shows. They're like, oh no, digital is easy. You just press this button and it's good to go. No, there's so many nuances to 3D printing, to removable process that you need to be aware of that takes time. It's a learning curve. I've been doing printed for a couple of years and I still have issues. So don't think it's going to be one and done kind of deal. Okay. Hopefully this will answer your question. And Dan, I owe you a beer.
Thank you. Thank you so much, Eugene. We have one more poll question for everybody, if you wouldn't mind answering. And I just want to let everybody know that Zahn is on the road again in September. We'll be heading to Sacramento, California for our 3D printing roadshow. And we'd really love it. If you're in the area, you want to register and enjoy a great day of learning from industry experts and being able to spend some time with us and your peers. That's September 27th in Sacramento. And then we'll be heading to St. Louis, Missouri. October 17th, we'll be having a hands-on 3-shape design course on removables. And then on the 18th, we will be having another road show there. So St. Louis will be having our innovations showcase, which is heavily, we'll be doing some design where we'll be showing denture design, all-on-X design, and some live demonstration on some nesting. What's up next on Zahn Academy in September, Corey Lambertson will be joining us from Asiga, and he'll be discussing lift trades, which is a new innovation from Asiga, and that will be on September 11th. And on September 25th, we'll be having 3-shape denture design pro tips. So join us for that. We are open for registration for our September courses, and we really look forward to having you join us. Again, I want to thank you so much, Eugene, for this
My
great
pleasure.
presentation. We appreciate you so much and look forward to working with you again. And I want to thank everybody for joining us here and trusting us with your education. Have a great day, everybody, and we'll see you next time on Zahn Academy.